Inguinal ligament. The inguinal ligament is a thick, fibrous band extending from the anterior superior iliac spine to the pubic tubercle. It lies beneath the fold of the groin. It is formed by the lower free border of the external oblique aponeurosis, which is thickened and folded backwards on itself. Thus, the lower aspect of the inguinal ligament is round, while its upper aspect presents a groove. The grooved upper surface of the inguinal ligament forms the floor of the inguinal canal. The strong deep fascia of the thigh, that is known as fascia lata, is attached to the lower aspect of the anterior length of the ligament, which makes it convex inferiorly by its pull. Now, various extensions of the inguinal ligament. First extension is the lacunar ligament or Gimbernard's ligament. From the medial end, the deep fibers of the inguinal ligament curve horizontally backwards to the medial part of the pecten pubis, forming the lacunar ligament. This ligament is triangular in shape with apex attached to the pubic tubercle. Its sharp lateral edge forms the medial boundary of the femoral canal, which is the site of production of femoral hernia. Now, second extension is the pectineal ligament. Pectineal ligament is an extension of the posterior part of the lacunar ligament along the pecten pubis up to the iliopectineal eminence. Now, another extension is the reflected part of the inguinal ligament. The superficial fibers from the medial end of the inguinal ligament expand upwards and medially to form this ligament. It lies behind the superficial inguinal ring and in front of the conjoint tendon. Its fibers interlace with those of the counterpart of the opposite side at the linea alba. Now, inguinal canal. The inguinal canal is an oblique intermuscular passage. It is about 4 centimeters long, lying above the medial half of the inguinal ligament. The inguinal canal extends from the deep inguinal ring, which is an oval opening in the fascia transversalis, to the superficial inguinal ring, which is a triangular gap in the external oblique aponeurosis. It is directed downwards, forwards and medially. Now, deep inguinal ring. It is an oval opening in the fascia transversalis and it lies about ½ inch above the mid-inguinal point. From its margins, the fascia transversalis is prolonged into the canal like a sleeve, that is known as internal spermatic fascia, around the structures that pass through the ring. Now, superficial inguinal ring. Superficial inguinal ring is a triangular gap in the aponeurosis of external oblique and lies above and lateral to the pubic crest. The pubic crest forms the base of the triangle. The sides, upper and medial of the triangle are called crura. These are the crura of the triangle, which meet laterally to form the obtuse apex. Near the apex, the two crura are united by intercrural fibers. These are the intercrural fibers. This superficial inguinal ring is about 2.5 centimeters long and about 1.2 centimeters broad at the base. Now, boundaries of the inguinal canal. The anterior wall It is formed by from superficial to deep by the skin, superficial fascia, external oblique aponeurosis, and internal oblique muscle fibers in the lateral one-third. Now posterior wall, it is formed from deep to superficial by the fascia transversalis. This is the fascia transversalis, conjoint tendon, reflected part of the inguinal ligament. Now the roof is formed by the lower arched fibers of the internal oblique and transversus abdominis muscle. This is the roof of the inguinal canal formed by the arched fibers of the internal oblique and transversus abdominis muscle. Now floor of the inguinal canal, it is formed by the grooved upper surface of the inguinal ligament in the whole extent and abdominal part of the lacunar ligament at the medial end. Now the contents of the inguinal canal, it consists of the supramatic cord and ilioinguinal nerve in the males, while in females it consists of round ligament of the uterus and ilioinguinal nerve. The ilioinguinal nerve, although a content of the inguinal canal, does not enter the canal through the deep inguinal ring. It enters the canal from the side through a slit between the external oblique and internal oblique muscles. It lies in front of the supramatic cord and passes out of the canal through the superficial inguinal ring to supply the inguinal region. Now supramatic cord, it is a collection of structures that pass to and fro from testes through the inguinal canal. It extends from the deep inguinal ring to the posterior border of the testes and is covered by 3 facial layers. Now the supramatic cord consists of the 6 group of structures. This is the transverse section of the supramatic cord. First content is the ductus deferens. It lies in the posterior part. Now there are 3 arteries: testicular artery in the anterior part. Now another content is the cremasteric artery that arises from the inferior epigastric artery. Another is the artery to the ductus deferens. This is the artery to the ductus deferens. It arises from the inferior vesical artery. Now third is the pampiniform plexus of veins that surrounds the testicular artery. Now lymphatics, especially from the testes, draining into the pre and para-aortic lymph nodes. Now there are also nerves, that is the genital branch of the genitofemoral nerve, and sympathetic fibers which accompany the arteries. And the last is the remains of the processus vaginalis. Now coverings of the supramatic cord from within outwards. First covering is the internal supramatic fascia. It is derived from the fascia transversalis. Second is the cremasteric fascia. It consists of loops of skeletal muscle fibers united by areolar tissue. The muscle fibers are derived from the internal oblique muscle. Now last is the external supramatic fascia. Is derived from the aponeurosis of the external oblique muscle. Now actually the inguinal canal is a site of potential weakness in the lower part of the anterior abdominal wall, but normally it is prevented by strength and good tone of the muscles of anterior abdominal wall by different mechanisms. First is the flap valve mechanism. The canal is oblique, Hence, it is deep and superficial inguinal rings do not lie opposite to each other. As a result, when the intra-abdominal pressure is raised, the anterior and posterior walls of the canal are approximated like a flap, and that is known as flap valve mechanism. Another is the guarding of the inguinal rings. The deep inguinal ring is guarded anteriorly by the internal oblique muscle, and superficial inguinal ring it is guarded posteriorly by the conjoint tendon and reflected part of the inguinal ligament. That is known as guarding of the inguinal rings. Another mechanism is the shutter mechanism. The internal oblique muscle surrounds the canal in front, above and behind. So this internal oblique forms the anterior wall, roof and posterior wall of the inguinal canal, and and thus forms its anterior wall, roof and posterior wall. When it contracts, when the internal oblique muscle contracts, the roof is pulled and approximated on the floor like a shutter, and this is known as shutter mechanism. Another mechanism which prevents the hernia is the slit valve mechanism. The contraction of external oblique muscle approximates the two crura, medial and lateral, of the superficial inguinal ring like a slit valve. The intercrural fibers also helps in this act. That is known as slit valve mechanism. Last mechanism is the ball valve mechanism. Contraction of the cremaster muscle pulls the testes up, and superficial inguinal ring is plugged by the supramatic cord. These were the different mechanisms that help to prevent the formation of the hernia. Now, some points about the Hasselbeck Triangle, that is also known as Inguinal Triangle. It is situated deep to the posterior wall of the inguinal canal, so it is seen on the inner aspect of lower part of the anterior abdominal wall. The boundaries of the triangle are: medially it is bounded by lower 5 centimeters of the lateral border of the rectus abdominis muscle, medial boundary. Now laterally it is bounded by the inferior epigastric artery, and inferiorly lies the medial half of the inguinal ligament. The floor of the triangle is covered by peritoneum, extraperitoneal tissue and fascia transversalis. Now the medial umbilical ligament, that is the obliterated umbilical artery, crosses the triangle and divides it into medial and lateral parts. The medial part of the floor of the triangle is strengthened by the conjoint tendon. The lateral part of the floor of the triangle is weak, hence direct inguinal hernia usually occurs through this part. So that was about the Hasselbeck's triangle. Now inguinal hernias. What is the inguinal hernia? A protrusion of abdominal viscera, for example loop of intestine, into the inguinal canal is termed as inguinal hernia. Clinically, it presents as a pear-shaped swelling above and medial to the pubic tubercle above the inguinal ligament. There are two types of inguinal hernias, direct and indirect. In indirect inguinal hernia, it occurs if the hernial sac enters the inguinal canal through the deep inguinal ring. It is known as indirect inguinal hernia. Usually it lies lateral to the inferior epigastric artery. It is common in children and young adults. The predisposing factor for this type of hernia is the complete or partial patency of the processus vaginalis. The indirect inguinal hernias are more common than the direct one and occur more often in males than females. The indirect inguinal hernias maybe congenital or acquired. Now after this we have a direct inguinal hernia. Direct inguinal hernia occurs if the hernial sac enters the inguinal canal directly by pushing the posterior wall of the inguinal canal forwards medial to the inferior epigastric artery through the Hasselbeck's triangle. So direct inguinal hernias occur through the Hasselbeck's triangle medial to the inferior epigastric artery. Usually the neck of the hernial sac is wide, so there are less chances of uh, avascular necrosis due to the compression of the vessels. So it is a safe hernia. The direct inguinal hernias are common in elderly due to the weak abdominal muscles. The direct hernia leaves the triangle through its lateral part or the medial part. So usually through the lateral part, because the lateral part is usually weaker than the medial part of the Hasselbeck's triangle. Accordingly, the direct inguinal hernia is known as lateral direct inguinal hernia and medial direct inguinal hernia.